If you struggle with anxiety, including constant worry and catastrophizing and thinking about the worst case scenarios, maybe you have physical symptoms like tension and nervousness, sweating, nausea, digestion problems, sleep problems, I'm going to share 7 surprising tips, not only to calm your anxiety, but to demolish it. There's some of my favorite tips. Hi, I'm Paige Pradko. I'm a psychotherapist that specializes in anxiety disorders and OCD. Welcome to Therapy for a Better Life. Now, if you're feeling symptoms of anxiety, I've left you a gift in the description of this video. It's a downloadable PDF and it's called Why Do I Feel That in My Body? And it's explanation of bodily symptoms due to anxiety, stress, and panic. Now, first, I call these tips surprising because I'm shocked by how many people do the wrong thing when it comes to treating their anxiety. They do all this stuff trying to calm down, but they don't know is that they're actually making their anxiety worse. So let me explain. Doing a bunch of things like relaxation techniques and supplements and medications in the moment, trying to get rid of their anxiety, sends a message to your brain that anxiety is bad, it's dangerous, because you don't want it. And your brain begins to fear anxiety symptoms in your body. And it actually ups the ante. It makes you more anxious. This actually causes your amygdala in the brain to get more activated, and that causes your fight or flight system to get more activated every single time your brain notices an anxiety symptom in your body. It makes anxiety worse, and it makes panic worse. Anxiety is calmed down through the use of paradoxical approaches. We actually do the opposite. Instead of trying to get rid of anxiety, we welcome it and we embrace it. And this sends the communication to the brain that you're fine and you're not bothered, you're not afraid, you feel safe. And the anxiety symptoms calm because the amygdala calms down and then the anxiety decreases. So let me review a few tips to help you send helpful messages to your brain to calm down your anxiety instead of upping the ante. Because your response to your anxiety is the most important factor that's going to determine whether you make your anxiety better or worse. Number 1, when you first notice an anxiety symptom, maybe you notice that you're worrying, maybe you notice you're jittery or sweating or tense. I want you to identify exactly what you're feeling. I'm having an anxious thought about, whatever your thought is. Or I'm noticing I'm a little bit jittery. Yeah, identify it. Identify and label what you're noticing. This is a cognitive method called cognitive diffusion, and it separates you from the thought. Number 2, make a decision to be non-reactive to your anxiety. I'm going to act like I'm not concerned at all. I know that you might be uncomfortable, but I want you to make a decision that even if I'm feeling uncomfortable, my behavior is going to be non-reactive. You're not going to do a bunch of stuff like trying to do, the deep breathing and meditation or go for a walk or take something or talk to somebody. None of that. We're going to talk later about those things because those are all good techniques, but not in the moment that you're feeling the anxiety. In the moment that you feel anxiety, your job is going to be non-reactive. You do nothing. Now, number 3, I want to talk about your overall attitude towards anxiety and anxiety symptoms. As I mentioned earlier, it's important to change your attitude from thinking about anxiety as something you don't want to something that you want and you even welcome. So anxiety is a normal condition that we all have as humans. Now, your brain can misinterpret things sometimes, misinterpret them as dangerous. And then you have to really retrain your brain that you actually are safe. Now, I get so many questions from people who are embarrassed by conditions like sweating or face flushing, or, they want to stop their heart from racing. They want to, stop these breathing issues or nausea or digestive problems. A number of symptoms that they just hate and they really don't want to have. And all they've been trying to do is avoid situations that make them anxious in order to not have these symptoms. But their frustrations and avoidance of those behaviors is actually making it worse. Again, sending messages to the brain, and it's activating the fight or flight, and it's teaching the brain to associate those symptoms even more so with anxiety. So instead, changing the attitude to one of welcoming the symptoms. Welcome the sweating, welcome the heart racing, welcome the nausea. Try to have those symptoms on purpose. I'm not saying that you want those symptoms, but you have to convince your brain that you are just fine with them. In fact, you want to have more of them. This is the way to calm down the amygdala and the anxiety response, sending messages to the brain that these symptoms are fine with you. Absolutely fine. You embrace them, you love them, you even want more. I tell my anxiety if it visits me and, right when I want to go to sleep or something, I just kind of have a talk with it. And I just say, oh, welcome anxiety. You can stay as long as you want. I don't get reactive to it. Now, number 4 is kind of a funny one, but it works for anxiety and rumination and OCD and what if scenarios, catastrophizing and worrying. Sing your worry out loud. You can sing it to a tune like Happy Birthday, or you can rap your worry or use any tune that you want. But singing really calms down your brain. I think your brain gets confused, almost like, well, if she's going to sing about it, she must not be very worried about it. Singing your fear or your worry or saying it out loud in a funny voice is another one of those cognitive diffusion techniques. And it really works. It really does kind of calm down the brain. Now, number 5 is having this attitude of willingness. It's called psychological flexibility, and it's really one of the foundations of positive mental health. Having a willingness to not be avoidant, to not resist situations and environments that make you anxious. Having this attitude that you're willing to be uncomfortable because you actually care about something, you value something, and so you're willing to put yourself in these situations where you're uncomfortable. This can be very helpful. Number 6, if you watch my videos, then you know number 6. It is the method that I call my I.A.M method, and it's a method you use in the moment when you have anxious thoughts or anxious sensations, and it's an incidental ERP, exposure and response prevention technique. I'm going to run through it just very quickly here. The I stands for identify. Identify the thought. I'm having an anxious thought. I'm having a fearful thought. This is that cognitive diffusion technique I talk about. A stands for allow. You're going to allow the thought or sensation to be there. It's just going to float there in the background. You're not avoiding it. You know it's floating there, but you're not going to give it attention. This is a non-reactive approach I talk about. You're not going to send this alarm to your brain with more worried thoughts or reactions. You're not going to check and see if that thought is still there or that sensation is there. You're just going to let it float there, and you're going to be non-reactive. M stands for kind of shifting your attention to something you're doing in the moment. Again, it's not distraction. You know that worry or that sensation is there, that thought is there, but you're not checking on it. You're shifting your attention to something that you can focus on in the moment. It's a mindfulness technique, and the M also stands for moving on in your day. Now, when you begin to use this technique, you may have to do it more than once, but as you get better at it, it does become more automatic. Number 7, I want you to review when you should, I want to review when you should do all of those techniques I was talking about earlier, those stress reduction techniques, the diaphragmatic breathing or square breathing, meditation, progressive relaxation, exercise, walk in nature. All of those practices are healthy and they're wonderful, but they do fall under stress management, practicing healthy lifestyle habits. We can all benefit from practicing stress management and self-care daily for our overall well-being. But we practice them as a lifestyle, like on a regular basis, just like brushing your teeth. They're not practiced in response to that anxiety right in that moment. And you know why, right? Because we don't want to alarm the brain that anxiety is bad and something we don't want, and so we have to do something really quick to get rid of it. That's what we don't want to do. You want to be non-reactive with your behavior and have an attitude of allowing, embracing, willingness, and that's what's going to eventually calm down the anxiety. And remember, there's no perfection here in treating anxiety. We just try our best. We have to be patient with ourselves. We have to be compassionate towards ourselves. You're training your brain that you're safe. And you can interrupt a worry thought at any time, an obsessive thought at any time, and start one of these techniques. Don't forget, I left you a gift in the description of this video. So until next time, I'll see you in session. Take care. Bye-bye.